My father was a dentist, and he first started his practice in Morley in 1974. And back then, I suppose dentistry was very, very different. If a patient actually presented in a great deal of pain or discomfort, or even they had broken part of the tooth off, one of the options was to always extract the tooth. And I suppose from a short-term point of view, it solved a lot of problems. Had pain or infection from the tooth was removed, pain and infection gone. Over time though, you probably realise this, is that dentists don't like taking out teeth anymore. And the reason for this is we realise that by taking a back tooth out, and because of the design of the mouth, is that it set up a cascade of problems. This is a photo where you can see that a lower tooth was taken out around about 15 years ago. And what you can see is that the top tooth that used to be resting against that bottom tooth has actually drifted down, or it's fallen down. It's exposed the roots, and therefore when the roots are exposed, the tooth becomes very, very loose. The other problem is the very back molar, the tooth behind the space, has also started to tilt forward. It also has lost its support. So what's happened is there's been drift of that tooth. And with this occurring, what happens is more food gets caught between the teeth. The back tooth is now tilted, so therefore you're no longer biting on the top of the tooth, you're actually biting on the side and pushing the tooth over. But more important than this, you can see how the gum and the bone has actually shrunk. If you follow a line from the front teeth to where this tooth has been removed, you can see that there's a large section of bone and gum missing, and this is what we call bone or gum shrinkage. The issue with this bone and gum shrinkage is really twofold. It is the height of the gum and bone that has shrunk, but also the width has actually shrunk. So what you've got is you've got shrinkage in all three dimensions. The issue now is if the patient said, can you replace this tooth, whether it's going to be with a dental implant or maybe a porcelain bridge or even a denture or a plate, the problem is it's very difficult or nearly impossible to do that because the top tooth has moved to the position, the back tooth has tilted forward, and this problem that happened because the tooth was removed 15 years ago has really set up the cascading problems that the patient will actually lose all of their back teeth.